I am Dr. Swapnil Jain, consultant neurologist, Manipal Hospitals Jaipur. So let's today talk about Parkinson's disease, especially in the young generation. So are you really too young to develop Parkinson's? No. Parkinson's disease is a neurodegenerative condition. Why it happens? It happens because there is loss of dopamine named neurotransmitter in the brain, in the specific areas of the brain, which leads to various manifestations of Parkinson's disease. It can be seen in young generation as well, which is known as young-onset Parkinson's disease. And usually nowadays the definition of young has also changed. So even the people who are in the age group of 40 to 50 qualify as young-onset Parkinson's disease. So what are the symptoms of Parkinson's disease? Parkinson's disease can have motor symptoms and non-motor symptoms. Motor symptoms we remember by the mnemonic TRAP. T means tremors. So there are specifically rest type of tremors. That is, a patient develops tremors in his hands when the hands are at rest. They decrease when the patient holds something or does some task. Then is R. R means rigidity or the stiffness. Patient experiences stiffness in the body while doing day-to-day activities. A means akinesia or bradykinesia or slowness of movements in the activities of daily living. So activities of daily living as simple as walking, turning in bed become difficult. A patient will take longer time to do all the activities of daily living. And P means postural instability. Patient will complain of difficulty in walking with difficulty in maintaining posture, especially while walking through the narrow walkways, especially while turning while walking. So patient may stumble upon, may fall recurrently, which leads to a misdiagnosis of a spine related problem, but it is usually due to postural instability. Then we come to the second part of symptoms, which are non-motor symptoms. In the non-motor symptoms, the patient experiences lack of facial expressions. So the face appears mask-like, and everybody says that the patient might be depressed, but that is not depression, that is a mask-like or decreased facial expression. Patient may develop increased or decreased sweating, increase in the amount of saliva production or dryness of mouth, increase in the sweating in the legs, feet and hands. Patient can also develop difficulty in passing stools as well as loose motions. There can be urinary difficulties and sexual dysfunction as well. So these are the motor and non-motor symptoms. Especially in the young generation, in the age group of 30 to 50, they get misinterpreted as part of exertion or fatigue from the day-to-day activities. Now, how do we treat Parkinson's disease? Parkinson's disease is treated with the help of medicines and in some special circumstances with the help of some surgical procedures. In the medicines, we have certain drugs which increase the dopamine levels in the brain, which come by the name of levodopa, carbidopa, with various salts which ultimately increase the level of dopamine in the brain. If the patient's symptoms are not well managed on dopaminergic drugs, that is, either the drugs are not effective or patient is experiencing side effects with the number of medicines that he is taking, then there are options of surgical management of the Parkinson's, which come by the name of deep brain stimulation, in which a chip is implanted within the brain, which periodically releases electrical signals so as to increase the dopamine concentration within the brain. There is also a procedure known as MRI guided focused ultrasound, which is specifically used for the tremors associated with Parkinson's disease. And then we have some invasive dopamine delivering systems which can be used, like levodopa, carbidopa infusion pumps and apomorphine subcutaneous infusion pumps. So Parkinson's disease is not a disease of old. It can be seen in young generation as well. So we all should be aware about it so as to recognize the symptoms early and get evaluated by a neurologist as soon as possible. Thanks.